Good health. It's all about balance and staying in tune with your body. But intuition isn't enough. Having regular screenings is vitally important to your long-term health. And now, the latest advances in diagnostic technology can be found in a beautiful, relaxed atmosphere. Introducing our all-new Women's Pavilion, dedicated to the healing arts and clinical needs of women. St. Tammany Parish Hospital. World-class healthcare for women close to home.
Welcome to Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Amanda Paxton. Lung cancer awareness is an extremely important topic, and with November being National Lung Cancer Awareness Month, today we have two guests here to discuss this topic. Although not the most common cancer in men or women, lung cancer is the leading cause of cancer death in both. It causes more deaths each year than colon, breast, and prostate cancer combined. Later, we'll hear from Dr. Chad Van Asselberg from North Lake Pulmonary Associates about types and treatment of lung cancer. But first, we have Kathy Bethel, a nurse navigator at Mary Bird Perkins Cancer Center at St. Tammany Parish Hospital, to discuss early detection. Welcome, Kathy.
Thanks.
Can you tell us a little bit about what you do as a nurse navigator at the Cancer Center?
Sure. Debbie Miller and I are nurse navigators. What we do is, first we do all new patient intake. So when a patient has a referral sent from their doctor with a new diagnosis, we get all that information and then get the patient scheduled with the doctor. Once they've seen the doctor and they need chemotherapy, the patient comes back to us again and we schedule their chemo education with us, the social worker, and the dietitian, and get them ready to start their treatment.
What type of chemo education would they go through?
Anything, no matter what it is, as long as the doctor has ordered chemotherapy for them, depending on their diagnosis, we would educate them on all the drugs they're getting before they start their treatment, so that once they start, they're aware of how the day is going to go during treatment, side effects of the medication, any tests that will be required during treatment, things like that. Okay.
Mary Bird Perkins Cancer Center at St. Tammany Parish Hospital has a new screening for low-dose CT for lung cancer. Can you tell us about that?
It's a low-dose CT scan recommended for high-risk people, high-risk lung cancer people. It's a quick scan that they do, and like it says, it's low dose. You go in, you do a quick scan, and it's of your lungs to see if you potentially may have any issues to catch early lung cancer.
Okay, and why would someone have this type of screening?
If you're a high-risk person, smoker for a long time, pack a day for 30 years, if you maybe were exposed to high pollution, radiation, things like that could cause lung cancer or any kind of cancer, really. But
is there an age that you should get this if you have one of those risk factors?
There are requirements for the test. You have to be age 55 to 77 to qualify for the test. You have to be a smoker and have smoked a pack a day for 30 plus years, and you have to either still be smoking or have quit recently smoking to qualify for the test.
Okay, so if you quit years ago, then you wouldn't qualify.
I think if you've smoked 30 years but you quit within 15 years, you still qualify.
Okay. So how would someone know they're at risk for cancer besides smoking? Is it just when you go to see your primary care doctor, they tell you?
Well, to qualify for this test, you have to be asymptomatic. You can't have any symptoms that would possibly be lung cancer. Yes, most of the patients are referred by their primary care doctor, but it's mostly just because you have those high risk factors, not because you have any symptoms of lung cancer.
And what is the benefit of this type of screening instead of other types of screenings?
Well, early detection is always the best. This is a low dose, so you're not exposed to high radiation with it. It's very quick. It takes 7 to 15 seconds once you're in the machine, so it's really quick. The results are sent to your primary care physician or to a radiologist, of course, reads the results, and then they're sent to the primary care physician, or if you don't have a primary care physician, they'll be sent to someone who's assigned to you to let you know about your results.
Okay, and so once you get the results, if they do notice something, it would go to?
A pulmonologist.
Okay.
Yes.
Okay, and how is this test performed? For those who aren't familiar with the CT.
CT scan, so it's a machine. You lay down on a table, and there's a machine that rotates around you. It takes like 7 to 15 seconds. It's very quick because it's low dose. It's just going to take a picture of your lungs, and then you get up and you're done.
Okay. What is the cost of this? Is it something that insurance covers?
No. I mean, not this test. This test is $99 cash. Paid when you come for the test, and then if there was an issue following, if something was detected, any other future problems would of course be covered by insurance. If you think you're a high-risk patient, call us, get screened. It's simple, it's easy. You're there for less than an hour. Better for early detection. The earlier we find something, the better. Hopefully we find nothing, but the earlier we find it, the better. It's much more treatable and curable at early onset.
Okay, great. Well, thank you so much for being here. Up next, we have Dr. Chad Van Asselberg from North Lake Pulmonary Associates to discuss the types and treatment of lung cancer.
Now that St. Tammany Parish Hospital and Ochsner are working together, advanced pediatric specialists can treat your child's most complex conditions close to home, giving you the peace of mind that comes with knowing your kids are in good hands.
Welcome back to Healthy Living, brought to you by St. Tammany Parish Hospital. Our next guest is Dr. Chad Van Asselberg from North Lake Pulmonary Associates, here to discuss a little bit about treatment and types of lung cancer. Welcome, Dr. Van Asselberg.
Good morning.
Can you tell us a little bit about what you do with North Lake Pulmonary Associates?
So I'm a pulmonary doctor, a pulmonologist. As far as lung cancer, we're one of the main entry points into the treatment pathway. We're the main referral point for a lot of primary care docs when they find a spot on an x-ray or something worrisome. So.
Okay. Can you give us some of the basic lung cancer statistics?
Sure. So lung cancer is the second most common lung cancer in the United States. It's second behind prostate in men and breast cancer in women. It's about 13% of all new cancers or lung cancer diagnoses. The estimates from the American Cancer Society, there's going to be 220,000 new cases of lung cancer this year and about 158,000 deaths from lung cancer. It's the leading cause of death from cancer-related events in both men and women. It accounts for about 27% of all cancer deaths. And to give you an idea, more people die from lung cancer than from colon, prostate, and breast cancer combined.
Wow. What are the risk factors for lung cancer?
The biggest risk factor by far is smoking. It's one of these cancers that's been strongly tied to smoking and all types of smoking, cigarettes being the worst, but cigar smoking and pipe smoking are also related. Just to tell you how strongly tied it is, they estimate that about 80% of all lung cancer deaths are directly related to smoking. Oh, wow. And as far as types of cigarettes, these low tar cigarettes or quote unquote light cigarettes are just as bad as regular cigarettes. And then there's also secondhand smoke is a risk factor too, not as high as direct smoking, but it does raise your risk. And they think that secondhand smoke alone accounts for about 7,000 lung cancer deaths a year. Then there are other less common causes, radon exposure. Radon is a gas that naturally occurs from decaying materials in the soil. It can be found in basements and houses. It's thought to be the second leading cause of lung cancer. And there are kits you can use to detect if this is in your house or not. And then there's other less common causes, things you encounter at work, asbestos being a big one with shipbuilding and such. And then other less common things with other technologies and dust exposures.
Okay. Can you tell us about the different types of lung cancer?
So when we talk about lung cancers, there's three main types we talk about. The names of them come from how they look under a microscope when a pathologist looks at them. And basically there are carcinoid lung cancer type, a small cell lung cancer type, and then a non-small cell. And then carcinoid is the most rare. It's less than 5%. It's a strange tumor in that it's very slow growing. It's not associated with smoking, it's just a random event. Small cell is the next most common. It's about 10 to 15%. It's the one that's most strongly associated with smoking. It's also, unfortunately, a very fast grower. It tends to spread very quickly. And then there's non-small cell, which is a group where they put kind of the rest of them. If it's not in one of those prior two groups. It's the most common. It's about 80 to 85% of lung cancers. And these are the subtypes of adenocarcinoma or squamous cell carcinoma or large cell. Those are the subtypes of non-small cells.
Okay. What's the diagnosis process?
So usually it starts with something seen on an x-ray, a spot or something that either your primary care doc picks up and that usually starts the pathway. And once that happens, we move into more diagnostic imaging, usually a CAT scan or a CT, which is just a fancy type of x-ray that gives us a better 3D picture, or a PET scan, which is a fancy type of CAT scan or CT that lights up when things are growing, when they're metabolically active. Those are usually the first few steps after a spot is seen. Unfortunately, symptoms don't usually develop until late in a disease, which is why lung cancer screening is becoming more important. We're figuring out that if we catch it earlier, we can do better things. But once we have a suspicious spot, the next step is usually to get a biopsy of some sort. And there's a few different methods. The most common methods are either a CT-guided needle biopsy, where we go through the chest, which is done by a radiologist, and they'll use a CAT scan to help guide the biopsy. We can also do a bronchoscopy, which is a scope that we as pulmonologists do. You go into the lungs and you can sample and take biopsies as needed. And there's actually a special type of bronchoscopy called an EBUS, which uses an ultrasound to help. You can see the spot you're biopsying, so it makes it a little safer, a little easier to access. And that's something that we provide. And then, of course, you can always do a surgical biopsy where we have a surgeon go in and cut and take a piece of tissue out.
Okay. And I know treatment is different for everyone, depending on type of cancer, how far along it is, things like that. But what are some of the treatments that someone would go through if they're diagnosed with cancer?
So to talk about treatment, a big thing is we have to figure out what stage you're in. Treatment depends on a few things. And by staging, we mean there are signs that the cancer has spread. So early stages are no signs it spread. It's just a spot by itself. And an early spread is maybe some lymph nodes that are close to that. And in later spread, more advanced stages are where we see evidence that this cancer spread throughout the body, either to other organs like the brain or to bones, things like that. And in lung cancer, there are 4 stages, 1 being the lowest and then up to 4 is the highest. So treatment begins or depends on 3 main things, 1 being the type of tumor you have that we discussed, 2 being the stage of that tumor, how far it's spread, and 3 being patient factors, how healthy is the patient, what are their other medical conditions, and then what is the patient's wishes or desires? Do they want to do some of these more aggressive options? The mainstays of treatment are 3 things right now. 1 is surgery. So we go in and remove the lung that has the cancer in it. This is the best option for early stage cancers. If we can catch it early enough, we can take it out. It gives you the best choice, the best option for a curative treatment to get rid of it. Other things include chemotherapy, which is medicines, either IV form or pill form, that kill cells that are growing. And then the other one is radiation therapy, where they can aim high energy waves at the cancer cells to try to kill it. So those are the 3 mainstays. There are some new therapies that have come out in the past few years, something we call targeted therapies. So some cancer cells, when they grow, they make mutations of certain proteins or certain enzymes. And if we make a medicine that attacks that enzyme, we can block that certain enzyme and kill that cancer cell. And then there's something called immunotherapy, which is also a newer therapy. And these are medicines that trick the immune system into attacking the cancer cells themselves. And those last two are relatively new.
Okay. Well, thank you so much for being here with us and for teaching us a little bit about lung cancer. This has been Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Amanda Paxton, and thank you for joining us. If you are a smoker and would like to quit, the hospital does offer a 9-week tobacco cessation program done by certified tobacco treatment specialists. They cover topics such as emotional triggers, dealing with withdrawals, and many other things to help you quit, including nicotine replacement medications. Evidence-based practices are used to help people quit smoking. So if you would like more information about this, you can go to stph.org.